Hello and welcome back to my channel. I'm Nurse Alyssa and today we're going to be talking about Mepilex Border post-op dressing. But first, if you could hit that like and subscribe, it would be greatly appreciated as it does help my channel grow. So let's get started. So the Mepilex Border post-op is a multi-layer absorbent, vapor permeable, wide border dressing with a silicone contact layer and a top film layer. Okay, so what that means is it's highly absorbent, vapor permeable, so it does allow vapors to pass through it. Okay, so from the inside to the outside. It has a silicone contact layer that goes against the skin, and the top layer is a film layer, which does mean it is shower proof. The silicone contact layer minimizes the incisional blistering, and it allows it to be safely removed without pulling on the stitches or the staples. So indications for use, this is for post-op surgical incisions with small to moderate amount of exudate, and that can be serous or blood. It doesn't matter. It'll absorb any fluids coming out of that incision. Precautions with any border dressing, you should not be cutting them because it's not going to hold the fluid properly and work as it should. With any Mepilex products, if you're using them with oxidizing agents, make sure that you are really drying the peri-wound skin before you're applying the dressing. So that's say like hydrogen peroxide. Some contraindications, we're not going to use any skin barriers or sealant with any of the Mepilex products, and you're not going to use on an untreated, clinically infected wound unless it's being treated, right? So any untreated, you don't use that for that. So just like any other wounds, we're first going to cleanse the incision, making sure it's nice and clean with some sterile saline, and dry the peri-wound. Next, if we're applying this to a joint, say a knee, we're going to bend that knee at a 30-degree angle before applying it, okay, just so that they have that range of motion, and it's not tight when it's straight and then they're trying to bend it and it gets even tighter. And then it does have a three-part backing, okay? So there's a little middle piece that comes off first. They all come off in order. So when you take off the middle piece, you can apply that to the wound and then pull off the longer piece and put that down, and then the smaller piece is last. And that just minimizes any bacterial contamination to the wound when you apply it like that. And if you take off all the back bandages at once, you're messing with the bandage then, and you're contaminating it, because even though we wash our hands before we touch any wounds or do any wound care, we have bacteria on our hand. There's no getting around it. So for removal, we're just going to gently lift the bordered edge and gently remove it from the incision. The expected outcome is that there is no maceration around the incisional opening, and that the exudate is managed well. The frequency of dressing change, that is also going to depend on how much exudate is coming out of that wound, so how much drainage. This bandage can stay on for up to 7 days, but we want to change the dressing when the exudate is about, when it's about 80% saturated with exudate, we want to change this dressing. Now it does come in different sizes, which you can see here, all different sizes. And just a reminder, we don't want to be cutting these, so just pick an appropriate size. So that is all that I have for this video. If you haven't done so already, if you could please subscribe, it would be greatly appreciated. And I will catch you in my next video. See you guys.